So again, I want to welcome everybody and thank you for joining the Interested Party Engagement session for clinical therapy services for Section Policy 19, 20, 21, 40, and 102. Next slide, please. As I said, our focus today is on clinical therapy services, and I would like in the activities and codes related to clinical therapy services as defined on this slide. So I would like to go over that quickly again. So clinical therapy services, including counseling, assessment, screening, therapy, and other services that require specialized knowledge and training in the treatment of patients provided by qualified and credentialed staff, including but not limited to board certified behavior analysts, licensed psychologists, licensed counselors and therapists, licensed registered nurses, licensed and registered nurses, and physicians. We understand there may be providers on the call today that provide clinical therapy services under other sections. However, those may be being evaluated in another rate determination process or project, which is conducted by Burns. For more information on other projects or sections of policy, please see the rate reform website. And we will also be including those websites and links in the chat throughout this call. Next slide, please. So this slide identifies the current clinical therapy services code for this particular rate determination project that we have identified with the assistance of Main Care. These codes in total are 6, and again, under section policy 19, 20, 21, 40, and 102. The procedure codes are 97129, 97130, 97535, 97537, G0155, and G9007. So when we talk about some of the questions that will be coming up in a little bit, just keep those codes in mind. Next slide, please. So during the next 60 minutes, we'll quickly review the rate determination process, project overview, goals, and activities, as well as get into those questions and opportunities for discussion and feedback. Next slide, please. So for introductions, I'll introduce the PCG team. Myself, my name's Rhonda Kern-Strelzer. I'm a senior advisor of behavioral health here at PCG and the lead for interested parties in engagement sessions. Emma Feinstone is our project lead and senior consultant. Maddie Wall's a business analyst, and Caitlin Crone is a senior consultant on our team as well that's on the call today. And they're going to be doing some behind the scenes items like taking notes, some of those things. So we do have some of the Main Care team on the call today. I'll turn it over to Tom Lee to start those introductions.
Thank you. Hi, guys. My name is Tom Lee. I'm the Long-Term Services and Supports Manager within the Office of Main Care Services. I've also got some other folks from my policy unit here. Kristen Merrill, who is the Senior Policy Lead here in the policy unit. Heather Binglis and Megan Brooks are also here from our policy team. I think that's it from OMS Policy. I'll turn it over to Dwayne.
Morning, I'm Dwayne Parsons. I'm the acting manager of rate setting for Main Care Services. I am joined by Jessica Levesque, our rate reform analyst, Jennifer Morse, our HCBS analyst, and Amanda Lee, our rate setting coordinator. And I will turn it over to, well, it does not look like Odes is on the call. It's Derek or Nicole here. I don't think so.
I did not see them yet.
Okay. All right. So I will not turn it over to Odes. I'll turn it back over to you.
Okay, thanks. Next slide, please. If they come on the call, we can certainly allow them to introduce themselves later on. So next we're going to talk about the rate determination process and a little bit of an overview. Some of you, if you attended the kickoff call or attended some of our previous sessions, might have already heard this, but do you want to go over it quickly again? This meeting does focus on feedback from participants regarding clinical therapy services. However, this slide highlights, a few things regarding the rate reform process, which sets schedules for regular rate reviews, benchmarking, creating a transparent process, as well as includes technical advisory and comments. So again, just wanted to outline that and what that process is quickly at a high level. Next slide, please. So on this slide talks about some of the steps for this rate determination process, which includes a kickoff call, which was held 8/28/24 and can be found on the rate reform website if you'd like to go back and look at it. It also includes public forums for feedback, official written comment periods, and when those open, that will be communicated as well. That will be a little bit further in the project. Also develop review and rate determination, final rate determination, which should be around April of 2025. So during this process, PCG will hold and conduct interested party sessions, collect data, we'll complete a different analysis, we'll develop a rate model, we'll draft rates, make presentations for comments, we'll finalize rates and publish them, as well as make final recommendations for consideration to main care. Also, I want to review a few items from the interested parties engagement standpoint. These meetings are the first that we're having right now, kind of general meetings to start gathering information. And we anticipate further meetings in the future with it, like kind of additional focus items, as well as a survey to gather additional feedback. In addition, we do have an email set up that you're welcome to send information, questions, or comments to, and that will be posted in the chat, as well as at the end, you will see that email. Next slide, please. So following those established requirements for the rate reform process, this project focuses on home and community-based services, including assistive technology and devices and services, care coordination, clinical services, clinical therapy services, which again is today's meeting focus, which again fall under main care sections 19, 20, 21, 40, and 102, supportive skill building, therapeutic interventions, and personal support services, as well as under the whole entire project focus. I do want to note other projects again are occurring simultaneously with other partners in main care during the same time frame. Again, they're reviewing other sections, payments, rates, codes. So if you're not seeing the section listed here, please check with the rate reform website for other ongoing projects. Again, this section meeting will focus on clinical therapy services. However, if you're interested in providing feedback for any other sections or services listed, we are having specific meetings for those sections upcoming, which are listed on the rate reform website in the kickoff presentation. Emails have went out and are continuing to go out through the email listserv, and we will also put the dates in the chat as well. Next slide, please. So the project goals for us is to develop and document appropriate benchmarking, service definitions, rates, and coding alignment. Engage closely with interested parties throughout the whole project lifecycle. Demonstrate the impact of changes to rates or service definitions, and then also ensure alignment to state and federal reimbursement requirements. Next slide, please. This slide just kind of shows some of our project activities and overviews up to this point. We started this into May, June. And so again, this does go through April of 2025. So currently at this point, up to this point, we have identified codes and rates for each section. As I said, they can be found on the rate reform link, which is posted in the chat, and then also on the rate reform website. We've been analyzing codes, trying to identify benchmarks, and for any services without benchmarks, we're creating benchmarks with input from providers, also creating assumptions based on best practices, national trends. So throughout this whole project, that's why we're going to continue to have interested parties, different engagements, and why those additional sessions or information will be needed as we continue this process. Next slide, please. So again, as I said, we have identified the codes for this particular section. So when you're answering any of these questions, please think about some of those codes, payments, methodologies, service delivery, those sort of things when we're talking about or providing feedback. Also, if you would like to respond, please raise your hand, come off mute. You can put information in the chat as well. I know sometimes people don't like to speak up, and that's okay. But we can certainly read those things aloud and again provide your feedback here. So with that being said, I'll go ahead and start with one of the first questions. And again, this is kind of in general. What concerns do you have about this rate determination process that you would like the team to be aware of regarding clinical therapy services? I'll give people a minute to kind of think about that. And if there's anything that you would like to raise or ask or bring to the table, any concerns, issues, or things that you just have questions about, please feel free to do that. And as we go through the questions, I will say there's 5 total. As we go through the questions, if we need to come back to one, that's fine, not an issue. Please feel free that you can bring that back up later on. That's not a problem. We can always go back or make sure that that's in there. Emily? Hi.
Hi, admittedly, I'm a state staff, so I just want to put some context out there for that.
Okay.
I'm with ODES, so this is not provider feedback, but I just wanted to bring up the piece. I don't know if this comes to mind for any of providers. I had noticed that in this clinical therapy services group, we see for sections 21 and 20, we see consultation behavior. And I just wanted to mention, to me, I was trying to wrap my brain around, because it earlier this week in the, let me get the phrase right, in the clinical services,
Yes.
clinical services, there was consultation psychological. And then I was noting that in the therapeutic interventions group would be consultation, speech, PT, and OT. So I just was wrapping my mind around the fact that, and I wanted to bring up the question perhaps that, like, for one service, with different modifiers, of course, and different areas of expertise. So one service will be discussed in different buckets. I just wanted to bring up that piece, and maybe that was certainly, I'm guessing, purposeful, but I just wanted to draw folks' attention to that it is, the scope of the service is the same, even though, again, we're talking about different disciplines. So that's one thought that came to mind for me that I wanted to just bring up for any providers as well, and for the team to think about.
That's a great point, Emily. Thank you very much for bringing that up and identifying essentially the consultation code for behavioral or psychological, whatever that may be, whichever section or bucket is in, is that an opportunity to look at those and do something there. So thank you very much for bringing that up, because I'm sure that could be confusing and having multiple different codes.
Rhonda, would you mind going back and showing slide 9 for people to remind them of the process
Sure.
that, thank you.
Actually, it looks like
And
it's like
maybe the
slide
one
8.
before it. Yep.
Okay,
Thank you.
sure. Are there any other concerns or items that anybody would like to bring up? Again, Emily, thank you so much for being the first person. Sometimes that's difficult. So definitely appreciate that and appreciate you speaking up about that as well. Well, if there's nothing else, we'll go to the next question. But as I said, we can go back, or maybe a question spurs something else as we continue through this. That's fine. We can always go back to that. So feel free to raise your hand at any point. Even if it's one of the prior questions, it's okay. Or like I said, you can put things in the chat as well. So the next question, are there specific codes or rates for this rate determination process where you think changes need to occur for clinical therapy services and why? And I can certainly give an example of, some of our previous sessions we've had. Yes, we can. Can you go back and show the codes from slide 3, please? So for an example, one of our previous sessions, they had identified, a Medicare code that was being used. However, it was causing issues in another code that private insurance companies were looking for or used to seeing, and that was causing some issues. So again, anything at all, related those codes that you might be concerned about or have concerns and why, or maybe some of the challenges in which you are experiencing something, please feel free to bring that up. And Emily, there was the code that you had identified earlier in this particular section down there at the bottom, that consultation behavioral code. So thank you. Anything with a specific code or rate that anyone would like to bring up? And again, not at this point, we can certainly come back to that if something else is generated and you're thinking in the future. I will also say some of this. Oh, Bridget. Hi, go ahead.
Hi,
Hi.
I'm Bridget Sullivan. I'm a program director at Neurorestorative in Standish, Maine, a 102 clinic. Thinking about the 97129 and 97130, those intensive codes, we use those pretty frequently. And thinking about the types of people who are providing that service, physical therapy, which is now a doctorate's level position, occupational therapy, master's level, moving towards a doctorate level, recreational therapy, bachelor's level, moving towards a master's level. I think if possible, a rate increase for those positions can help 102 clinics be a little more competitive, where a private insurance might be reimbursing for more. In Maine, we are competing with the Boston area as well, which is a much higher rate. So I think that could help have this type of work be a bit more competitive if there was an increase there.
Perfect. I appreciate you bringing that up. And So with that also being said, are you, because that level of skill and credential and education is required, are you guys also seeing difficulty with, like trying to recruit people in as well and keeping those individuals?
Yes.
Okay. Okay. That's great information to know as well. So both of those pieces are absolutely something we need to hear as for our team, and certainly something we'll take back and also be considering as we look through these. Is there anything else that you would like to, any other codes that you have those situations or changes with staffing or educational requirements or anything?
I haven't ever used the other code, the 97535 or 97537. So I don't have any feedback on those. And then those last two codes are not part of 102.
Okay, perfect. Thank you so much. I appreciate you providing feedback. We really, really do appreciate that. Are there other things that anybody would like to bring up or add maybe to the conversation that we just had? Okay, well, like I said, if we need to go back, we certainly can, or if there's something else later on that comes up. So with that being said, we'll go to the next question. Are there gaps in existing payment methodologies for this rate determination process to highlight for our team regarding clinical therapy services? I'm trying to remember one of the examples from one of the other meetings we had, but I think one of them was in regards to Bridget, what you had brought up regarding, staffing level and education needed and the payment or reimbursement for the services delivered. So I think that was certainly something there, we could add into here as well, just what you brought up. So, but that was one of the examples that we had heard some of the last sessions. So are there other gaps or is there other challenges that you face in delivering clinical therapy services due to the current payment methodologies? Go ahead, Bridget.
I don't know if this is applicable to this question or not, but one challenge is the evaluation code. I know we're not reviewing that code in particular, but if somebody has a lot of falls and in and out of the hospital, they have to discharge from PT, they come back a week later and they're ready for us to start PT again. Sometimes if there's not enough of that evaluation code per year, we end up having to use the intensive, that 97129 and 30 code. So that is a challenge.
Okay. So when you say you have to use, when you use that 97129 or 130, like how often are you seeing that? Like where you would have to do like something like that?
Often. I don't know if I have it at least once per month.
Okay. Okay.
Just want to step in here for a second. Bridget, can you outline what the challenges are for having to use that other code? Like what the impact on providers is for having to go that route?
It's, I think, more about the person that we serve. If somebody, we can only justify using that code if we know that they are going to be picked up for that intensive service. I think it's helpful for people to have evaluations to maybe get screened out of a service and maybe have some initial recommendations that that can be used without picking them up on caseload. So if they've already exhausted all of the evaluation codes and they're not applicable for or eligible for that intensive code because they won't be an intervention is not being provided, it's just an assessment and recommendations. Like we can't get for that, and we might not provide that service then if there's no reimbursement for it.
Thank you. That's very helpful.
Yeah, absolutely. That is really helpful context. So you are at minimum seeing it, it sounds like once a month, but can be often more times. It just depends on the service or, the person that would come through for services. Okay.
Yes.
Okay. No, very helpful. Thank you so much for adding that and providing that context in that challenge. So that's perfect. Does anybody else want to add anything to that or provide additional feedback or maybe something else? Well, again, if we need to go back to a question or something like that, we certainly can. It's not a problem. You can put things in the chat as well. So please feel free to do any of those things or raise your hand or come off mute and provide any feedback that you would like or something that you just thought about. Let's go to the next question, please. What do you think is most valuable for our team to know regarding clinical therapy services for this rate determination process? And I can give you an example in one of our previous sessions. One of the things that they said to us was there's a difference between case management and care coordination. So that was something that, they really wanted us to know and make sure we were aware of. So are there any things that you feel like are really important that our team is aware of as we're going through this process and looking at some of these codes that you really think we need to be aware of and know as we're starting to look through these and dig in more? Or maybe another way to put it is if you had to tell somebody about clinical therapy services and what you do, is there sometimes a challenge or a way that, how that care is delivered that you would really like people to understand if you could tell them? Oh, go ahead, Bridget.
Hello again. I think an important thing with 102 is that some people do make remarkable gains and get better and improve, but a lot of people are maintaining, and commercial insurances are probably 6 visits, 12 visits, and needing that really strong rehab potential to justify services. But for us, helping people to either maintain or improve their level of function is really kind of a special thing. And the goal, I think, is keeping people out of nursing homes for as long as possible. And the cost associated with people entering that skilled nursing facility type of care, like that's much greater than people being able to live in the community, live with family members, live in group homes, and be able to access therapy in a community setting. So again, I'm in favor of the rates increasing and being able to get reimbursed at a higher rate, knowing that even if the data might show that people are not necessarily like, look at all this progress they made, even if it's just maintaining, that the benefit of that is that they're not rapidly declining in a nursing home requiring way more resources.
That's a great point. Thank you for bringing that up. Certainly something that is valuable to our team to consider and look at and certainly understand from that perspective of more of that maintenance as a lot of times in your section 102, correct? So a lot of times it's more maintenance is what you guys are seeing in a lot of the clientele population. Okay.
And hi, my name is Corinne. I'm joining a little late, but I guess just to piggyback on that, and you may have already said it, but it was interesting during COVID when a lot of our patients couldn't come into our 102 outpatient clinic, and they were finally able to come back. Some maybe even almost a year later, or even 6 months later. We saw a significant decline in many areas with just that 6-month gap to a year gap of no services. So that was definitely very telling on how important that maintenance level of service is.
Absolutely. Thank you for joining us and thank you for providing some additional context here. Appreciate that. And that is, again, something valuable for our team to understand when you're looking at the flow of, patient care and how payments and codes and all those things operate. So thank you very much for providing that to us. Is there anything else anybody on the call would like to add to this conversation? Well, I think it's been very helpful for us and those on our team, certainly when we take this back as well. As we continue this project, those things will be very helpful. If we need to go back to some other questions, or again, if something else has spurred thinking on your part while we're continuing to talk about some of these things or these other questions, that is okay. Just raise your hand. We can certainly go back. And if there's nothing else on this question, we will go to the next slide. Next question is there any additional information regarding clinical therapy service delivery, payments, and/or codes that you would like to share? We've kind of focused on specific questions, trying to understand and get, like I said, gather information. But, there may be things that we have not identified or not talked about yet that you really feel is important. Because again, you guys are the ones delivering services and certainly, understanding what's happening out there in the world, as well as what those codes and how that impacts your business payments, those sort of things that we've kind of talked a little bit about already. So there may be something we've missed, but please, we absolutely welcome any additional information regarding the delivery payments or codes for clinical therapy services.
I mean, I don't know if this would add to it. I'm not really sure. I guess I'm clear as to what the question is, but and I don't know if there is opportunity to change the codes or redefine the codes a little bit, but sometimes the way the codes are divided into, the 15-minute increment, the 30-minute increment, sometimes it creates a loss of time on our end and a billing opportunity based on if a client comes in, late to a group or transportation's running late, and so they've started their morning late. Sometimes we lose, units, billable time, even though we're spending time with the patient because we've missed that 30-minute time frame to build that 164. And so sometimes that makes it difficult, or we're locked into using, we only have so many codes to use for so many hours of delivery for the week. And sometimes we're locked into that. So if a patient or a therapist is out, we can't recoup an hour of therapy because that one-on-one code now can't transition to group codes. And that's all maybe the only other service that patient's getting. So now we've, lost a therapy code because they don't, they just don't feed into each other, I guess. And I understand that we should have, separate codes for one-on-one delivery of services and whatnot, but sometimes the system kind of works against us.
And Corinne, a couple of things. One, Kristen had identified, can we go back to some of the questions so we can review them again, and you can provide any input if you would like, and we will certainly do that. Number two, would when you say there's a missed opportunity, is it a missed opportunity for therapy to occur or that service delivery to occur for the individual? Or are you saying the service and delivery is occurring, but the opportunity is missed to receive reimbursement because of those things that you just identified?
And someone, obviously other people who are on there who bill 102, provide 102 services, certainly jump in if I'm not being clear, because it's kind of not clear in my mind what I'm trying to say, but I feel like it's a little bit of both.
Okay. So you're saying both things can occur?
Both things can occur. Yeah.
Okay. And I am also on the main neurobehavioral health and on that side and project as well. So I have also heard some different things, and I think let me just clarify again if this is what my understanding is from some of that project. But individuals sometimes have difficulty getting to clinics, for an example, and so you're saying when they're late or that transportation or that bus, those sort of things may be late. That's how that could occur as well. Is that my understanding too?
Correct. Yeah.
Okay.
Yeah. Or,
Okay.
this, I guess maybe I wasn't as clear, but let's say a patient's coming in for 10 hours of service under 102. They have 9 hours of group codes to use, 1 hour of a one-on-one therapy. Maybe they're getting some physical therapy. And maybe maybe the therapist is on vacation, right? Or out sick. And if no one, if I don't have another PT to cover that hour, that is a lost opportunity, because that one-on-one code is now, can't be used. So now that patient's only getting 9 hours of therapy that week. Because those situations happen as well. And you're just sort of locked into, okay, I can only deliver 9 hours of services therapy to this patient.
Right.
Because that one-on-one code can only be used by that PT because that's what you've,
That's what you've
allotted it
authorized.
for. Yeah.
That's
So,
what you got authorized is for that
Yeah.
particular therapist only to use that particular code.
yeah. Or if
For-
you're
with
using
that-
up, yeah.
That particular patient or, consumer or
Yeah.
okay. Okay. So how often does that occur?
I'd say
Is that-
often. I'd say often. Yeah. Not,
Okay.
not weekly, but I'd say monthly for sure.
Bridget, I see you shaking your head. Do you want to add?
Yeah, I would say probably weekly in my clinic at least. And um, maybe there's something special going on during the week and somebody wants to go join the gym group or do something
Mhm.
outside of their typical schedule for that week, and they're opting not to do their physical therapy, but then they don't have enough group codes to do that service that they're selecting to do that is still beneficial and therapeutic. So we're
Yeah.
providing a service and not getting paid for it, and then there's units left on the table at the end of the week that they're not able to recapture elsewhere.
Yeah.
Perfect. Thank you both for identifying that and bringing that up. I mean, not only is it from a provider perspective, but it certainly also impacts the patient as well, and service delivery, and quality of care that the patient would receive as well. So, okay, perfect. Anything else related to that topic? And then if not, Corinne, we will go back to the other questions. Caitlin, if you could go back to slide 13. Or 12. Okay, 12. Yeah. And Corey, please feel free to add anything, or if you don't have anything that you want to provide, that's okay. You can just say, I don't have anything to provide, or, go to the next question, because there's 5 questions total, and you, I think, came in on the last 1 or 2. So the other question was, what concerns do you have about this rate determination process that you would like our team to be aware of regarding clinical therapy services? Is there anything that you would like to input on that, Corey?
Can't think of anything
Okay.
other really than what I've said. Yeah.
That's okay. If something pops up, we can add it later. Not a problem. Next question. Specific codes or rates for this rate determination process where you think changes need to occur for clinical therapy services and why. And I know you just kind of discussed a few things, but if there's anything else that you would like to add or other codes that you would like to bring up that you think needs changed, I think they're putting the code list in the chat right now for this particular section. Yes. The code list for this section was just put in the chat. And again, as a reminder, this session today is about sections 19, 20, 21, 40, and 102. Anything, Corinne, that you would like to add?
I can't think of anything. Yeah.
Okay, that's okay. And the other
Thanks.
thing, Corinne, no, not a problem. I'm thankful you came on and certainly provided some input. The other thing I was going to say is there's also an project email, where if you think of things you want to bring up, or comments, questions, or anything like that later on, you can certainly email that, and then we'll get back with you, or add that as well. And Emma just put it in the chat for you as well. And then it'll be showed at the end. So don't feel like you're put on the spot. If you don't have anything or can't think of anything right now, it might come later. That's okay. There's still opportunity to provide that information. Just wanted to give you the chance to look at a couple of the questions and provide any feedback if you'd like here
Yeah,
today.
I appreciate that.
Yeah, absolutely. Next slide, please. Are there gaps in existing payment methodologies for this rate determination process that you would like to highlight for the team, or challenges with the payment methodologies with some things? And I think you kind of brought a couple of those things up already, but didn't know if there's anything else or if you wanted to add anything.
No.
Okay. And then what do you think is most valuable for our team to know regarding clinical therapy services for this rate determination process? If there's anything, and if not, like I said, that's okay.
Okay. Yeah.
But if
All set.
I was gonna say, but if there is, we will love to take it in.
Okay.
Yeah. And then I think next slide is maybe where you came in at. Is there any additional information you would like to know regarding clinical therapy service delivery, payments, and codes with Bridget's conversation?
Yeah, I'm all set.
Okay. Is there anything else anybody would like to provide on this call as we've continued through this. I know we're almost done. We have our project email, again, for communication questions and comments here. It is also in the chat as well. You can email that. That goes to us here at the Public Consulting Group or PCG group. That comes to us. So if there are questions or comments or things you want to provide, please feel free to do so. Also, again, if you'd like to add any information for the 5 questions, please feel free to do so. And I'll give another minute to, in case anybody thinks of something they want to add. And if not, we will close out this meeting by saying thank you, everybody, for attending. I certainly appreciate your input and feedback. Certainly is something that will be helpful for our team as we continue throughout this process. As I said, there will be other opportunities, so please check out that email listserv. Sign up for that. Also check those out. If you want to attend other sessions and provide feedback for some of the other sections or codes that are listed in those sections, please feel free to do so. We have some more coming up over the next couple of weeks. And then again, if you would like to provide comments after we get off this call, or maybe later on or during the project, you can also email us as well. So several different opportunities, as well as a survey will be coming in the future as well. For some of you, they may be able to provide additional information. So Emma just posted the schedule again for the interested parties engagement sessions. Say that fast 5 times. And so that's out there. And looks like maybe Amanda's putting in maybe a link. We'll wait and see what that pops up to be. But again, I appreciate everybody and joining us today, providing the feedback, certainly very helpful. And we'll wait till Amanda's last chat comes up, and that's to sign up for bulletins with the Maine Department of Health and Human Services and sign up for the listserv and those things. So that's out there as well. So please feel free to do that. Happy to have people come back for some of the next sessions and appreciate you guys being here today. And with that said, I'll say thank you very much and have a great weekend. Bye.
Thank you.
Yeah, bye-bye.